Today, this is part of the ulcer treatment and it's part of the recall. There was one question when a particular ulcer was put as a spotter and asked the treatment of choice, and there were options. Now, this particular presentation is not intended to cover everything about an ulcer. This presentation is only for the ulcer that was projected in your exam and probably a little bit of lateral clarity. So let's go straight away into the question. An ulcer like this was shown. Now what is striking is very red granulation tissue. Now for this, I suggest the different types of ulcers to please see my presentation on parts of an ulcer, and the link will be shared in the end screen. So let's look at this. The treatment of choice for this ulcer is a full thickness graft, a split skin graft, a rotational flap, or a composite graft. Now the answer is a skin splits graft. Fine. This is somewhere in the middle of the leg. So you can put a split skin graft there. One, because now does he need a split skin graft? Yes, he needs. Because does he need a cover? Yes, he needs. First question, because the ulcer is large. And what type of cover? Bed is very clean and in a non-weight bearing area. So you can get away with the split skin graft. Full thickness, he does not need. Rotational is an overkill. Definitely not a composite graft. He has not lost muscle or bone to go and get a composite graft, which will be again an overkill. There is something known as a step ladder pattern in skin cover. If you know that pattern, then you will not use an overkill modality for patients. Similarly, like the way you have a step ladder pattern for pain relief. Now, let's quickly come. So you will put a skin grafting. I don't have a skin grafting for this particular ulcer, but you can see we have put a skin graft there. Similarly, the skin graft is here. Fine. And it has been meshed so that a small graft will cover a big area. Not only that, whatever secretions are there in the bed will come out through these interstices, these openings. It will come out so that the graft will not get lifted up by pressure. This is an example of a skin graft. What I wanted to show you was this particular instrument. This is known as a skin hook. Okay, next. Ulcer on the anterior abdominal wall, not weight bearing. Have a look. What will you do? Immediate SSG. At this time that the image is being presented to you, would you put an SSG? Delayed full thickness, rotational flap, or daily dressings. This is non-weight bearing area. I've told you it's in the abdominal wall. It can be covered with an SSG, but not now. Daily dressings, let the ulcer develop healthy granulation tissue, then you can go for an SSG. So it's not an immediate SSG. So your answer will be daily dressings. Clear? Now, I have changed the size of the ulcer. I've changed the site of the ulcer, and I've also introduced age there. See how the stem can keep on changing. Naturally, your situations will change and your answers also will be different. So you have a reasonably healthy ulcer there. It is red because of the color, because of the photography color, it's not showing well. Doesn't matter. You assume it is healthy. Would you put an SSG full thickness or let it heal by secondary intention or get it healed by delayed primary? Delayed primary is nothing. You cleaned it in the first place. You let it heal for some time. Then you hasten up the healing process by suturing it. But for suturing, you will need anesthesia. It can be done under local in an adult, but in a child, you will need anesthesia, which is general anesthesia. Now, if you have a look, whether I'm going to let it heal by delayed primary or let it heal by secondary intention, it will take maximum, this will be about a week, this might take 10 days. So for the 3 days, do I need to expose them to anesthesia? Number one. SSG for this small area, no need. If it was large, you could have considered an SSG, but this is small. So a small ulcer, it's in the scrotum. It can be left to heal by secondary intention. There will be no functional and cosmetic issue in the scrotum. But in other parts of the body, you can have, when you let it heal by secondary intention, you can have scar formation, very bad scar formation leading to even functional problems. So the answer is let it heal by secondary intention. Fine. Now have a look. This is an ulcer on the medial aspect of the thigh. Fine. What is your treatment? Immediate skin excision and SSG. Excise the skin like the way you do in burns. Do an escharotomy and do an SSG. But we did not tell you it is burns. We told ulcer. Fine. You can put a hydrogel dressing. You can put a debridement or a vac dressing. One, immediate skin excision and SSG not done in non-burn skin death. That you must understand. Hydrogel dressing is only to hasten a ulcer to heal. So what you will do is a debridement. You should get rid of these things. This debridement can be done by surgery or by certain chemicals. One of them is your papain, enzymatic preparations. So the answer will be debridement. You can see a surgical debridement going on there. Then you can decide to put a vac dressing. Then you can put an hydrogel dressing. Finally, you can take for an SSG, but not immediate. So the answer here will be a debridement by whatever methods is appropriate and available. So as usual, I will ask you to share, subscribe, and thank you very much. Please do follow my Telegram channel also. And I again tell you, this is targeted at answering that question. Only thing is, because we were on the topic of ulcer and healing and the best treatment, I brought in a few more case scenarios so that you don't go with the idea, ulcer is this answer. No, ulcer what? So automatically you will know the surrounding issues of that ulcer and give the option that is best suited, which has been given in your option list. So this is what I want you to take home. Not just look at this picture, because this picture is not going to come second time. They will tweak it. This is just for you to get the concepts right. Thank you very much, and please do post in the comment box what exactly you want to be handled in my YouTube channel. So thank you again.